morning after two recent stories in the news. The sudden death of the singer George Michael due to heart failure, according to his publicist. And also, of course, the actress Carrie Fisher's cardiac incident on a flight just before Christmas. ABC News senior medical contributor Dr. Jen Ashton says there are lessons here for all of us.
100%.
So good morning.
Good morning.
Are there differences between the way men and women experience these cardiac incidents?
We finally know the answer to that question, Dan, is an overwhelming yes. But that word has to filter out to the public. We know that there are differences in men and women in their symptoms, in the causes, in the treatment, and in the survival. So you need to know the common symptoms in women. Take a look at this list, whether you're a man or a woman, because this could truly save someone's life. The common symptoms of a heart attack in women: nausea and vomiting. They get like a stomach flu-like symptom, shortness of breath, unusual fatigue, or chest discomfort. It doesn't always have to be chest pain. It can be pressure. Basically, if you are a woman and you are feeling something bizarre from your jaw to your belly button, call 911, think heart attack. It's better to be wrong than be dead.
Yeah, and some of those symptoms that you just mentioned kind of mask themselves as something else, even
Exactly.
like flu-like symptoms.
Yep.
But you have said, and this is really your platform, that there is a crisis in women's health knowledge and women actually knowing more about this particular topic. It's killing people. What do you mean by that?
It's killing people. I think women don't know enough about their own bodies, and the medical profession still has a lot to learn about gender differences and how different diseases present, male versus female. I think if you look at these statistics, this is jaw-dropping. At least 90% of women have at least one risk factor for heart disease, and they're unaware of that. Only 36% of black women know that heart disease is the #1 killer of women. About half of African American women have heart disease, and these are women over the age of 20. And if you look at Hispanic women, only about 12% of Hispanic women have ever discussed heart disease with their healthcare provider. We need to do better in the medical world, but women need to take the reins of this themselves, too.
Now, Dr. Jen, you just last Friday, you discussed a study from the American Heart Association which showed an increase in out-of-hospital cardiac arrests, or cardiac deaths.
Yeah.
Does this apply to, this clearly involves George Michael, but also possibly Carrie Fisher.
Right.
What can we do to avoid this?
Well, look, we're seeing it because these are world-known celebrities, but this is happening to the everyday person. I think the key thing about heart disease is 80% of heart disease is preventable if you modify risk factors. If you look at these risk factors for women, adverse pregnancy outcomes, gestational diabetes, preeclampsia, smoking, overweight, and obesity, elevated numbers in your cholesterol, diabetes, and blood pressure. Control these risk factors, and you can lower the risk of heart disease.
Dr. Jen, thank you so much.